Welcome back, Cynara. We want to talk about breast implant. This is something that we got a lot of questions about this. People want to know what type of implant they should be getting. Should be getting like saline, should be getting like silicone. What's the difference? And the statistics is that this is a #1 cosmetic surgical procedure. About 279,000 of these surgeries are being done. Right. And I asked you to bring in some examples of this. I haven't actually never seen some of these before, so maybe you can show us some of these implants. I thought this was saline, and I fell for it.
Right.
I was wrong. So tell us, and I'll play with one of them if that's okay. I'll just hold it so I can feel good about this. So tell us.
Have you ever played with one ex vivo out the body?
No comments. I'm not going to go there. So.
So it sort of depends on why you're having implant surgery, right? So there's augmentation where you're doing it strictly for cosmetic purposes, and then there's implants that are needed because a patient's had a mastectomy and we're reconstructing a new breast. So these types of implants are called teardrop implants. So I'm sure you can probably see it, but they're a little bit thinner on the top, fuller at the bottom. So we call them a teardrop implant. These are great for somebody who's either very small breasted or has had a mastectomy because there's just skin and subcutaneous tissue over the implant. So you're really seeing the shape of the implant. So it gives you that more natural look where we're thinner on the top of our breast as opposed to the bottom. So and that way you don't look like you have a cantaloupe attached to your breast. So these are great.
This is what? Usually this is a cup. B cup or C cup? Or
this is probably a C cup.
C cup, which is probably the most common one out there. You know, it's very interesting because years ago in 1990s and 2000, bigger was always better, and bigger size was always in. Yes. And now people are going for more natural look as you're discussing.
Smaller, right? So a lot of women wanting to change from their large implants to their smaller implants, but these are great for a more natural look. And then you have the rounded implants, which is just a round circle. With the rounded implants, you get a little bit of this dimpling. I don't know if you can notice, but the implant's kind of dimpling a little bit. So if you had a mastectomy, you're going to see a little bit more of that dimpling than if you were doing this just for augmentation, where you have some of your own natural breast tissue underneath it. Silicone implants have changed dramatically over the last 5 to 10 years. I'm sure you remember the controversy that came out where there was a concern that silicone implants were causing lupus because the silicone was leaking out. And I've done surgeries on patients where we've taken out their old silicone implants and the implant has ruptured. They didn't know because the body itself has formed a capsule around the implant. And the silicone is just stretchy and slimy and sticky. So these don't do that. So if they rupture or break, you can cut this in half and it's going to be 2 solid pieces.
These
so you
are
don't
the
get
new
leakage.
ones.
These are the new ones. These are the new silicone implants. You can get saline implants as well. Silicone implants tend to be more popular because they're softer.
More natural feeling.
And more natural feeling, exactly, as opposed to the saline implants.
Now, if you have a silicone implant that actually has some rupture, and I know you deal with breast cancer all the time, what's going to happen on mammograms? And what do they see? Do they confuse that with some sort of a cancer?
So, not typically. So saline's not an issue because it's just salt water that's released. Silicone, everything, it just remains encapsulated within the natural capsule that your body formed around the implant. Many times augmentations, especially if a patient's had a mastectomy, the implant's put underneath the muscle. So you're definitely forming a capsule around the implant and it remains contained. So they can tell.
That would make it easier also in case they have to replace it in the future, or that doesn't make much of a difference?
It doesn't make much of a difference.
Okay.
It doesn't make much of a difference.
All right, good. What are some of the complications from this? I know you wanted to talk about the fact that experience plays a big role. And I know a lot of you may find a way to get this cheaper, or you may travel to other places, but there are some complications in the hands of people who don't know how to place. I don't mean to squeeze this too much, but you know, what are some of the complications of these breast implants?
So infection certainly being one of them. Misplacement, capsular contracture is a pretty devastating complication, and that can happen more with mastectomy patients who have had radiation or need to have radiation. And that's when the implant gets a lot of scar tissue formed around it and it gets stuck in one place. Hopefully that's in the correct position, but sometimes it can be too far to the side or too high up, so you develop a difference between the two breasts. So that's probably the most devastating complication in regards to cosmetics, the cosmetic outcome.
And how long do they last, or do they need to be changed every 5 years, 10 years?
These don't need to be changed. Oftentimes women may end up getting revisions, but that's because their natural breast tissue has fallen below the implant, so they need to get that readjusted. Or if they've had a mastectomy, sometimes the implants have dropped a little bit too low. So you may need to get revisions based on that, but not because of the implant.
Okay, that's great. So I hope this was helpful. And if you have any more questions about breast implants, they're here. You can always email them to us, and I'm happy to answer them on samaditv.com.